Ryan Calfee here. I just wanted to send along a quick best wishes. Thank you again for all the smiles and hugs. You know, being that supportive person every day at work made every day at work at Brown a brighter day. Congratulations and best wishes on your retirement.
Hey, Dr. Bourne, this is Nicole Arcand. I just wanted to wish you a extremely happy retirement. I definitely have a lot of great memories of working with you. When I started in practice, I was the talk of the OR by doing long TFNs without locking distally. So I always thought of you, and I still do every time I do one of those cases. I really wish you all the best, and thank you so much for everything you gave us. Really appreciate it.
Chris, Mark Tompkins here. Congratulations on your retirement, and thank you for all you've done for the department and for residents and fellows like myself. I'm very grateful that I got to train under you. One of the many things that I remember that I took away from my time with you is how cool, calm, and collected you were in the operating room, regardless of what was going on. And I oftentimes think about that when I find myself in a challenging case with lots of things to be thinking about. So thank you for all of that training and the example that you set. I also want to make sure to communicate my admiration. I think you know this, but my admiration for your crisis and disaster management work in the US and overseas. You've contributed greatly to the department and contributed greatly to our field of orthopedic surgery. Thank you for all you've done, and thank you for the education you provided for me.
Hi, Dr. Bourne. Greetings from Dallas. So I congratulate you on a well-earned retirement. Can't believe it's been 10 years since Super Chief year. I was just looking back at our old whiteboard you took a picture of from all the quotes from the year, and you had a bunch of good ones there. Some which are not so safe for work, but I think one of my favorites actually came from you. We're talking about pelvic fractures and some of the complications related to that, where you very rightfully pointed out that dyspareunia is better than no pareunia. So with that, I wish you all the best. And if you ever find yourself out in Texas, give me a holler. Take care.
Hey, this is Craig LaRoe in Western Mass. I just wanted to take a few minutes to express my gratitude to Dr. Bourne for training me and for his mentorship both during and after residency. Dr. Bourne not only taught us orthopedic trauma surgery, but also clinical research, the importance of humanitarian outreach work, and how to apply our expertise to med device product development. When I think of Dr. Bourne, I think of someone who was patient, wise, and really showed a genuine interest in resident and fellow development. I've come across other orthopedic surgeons after residency, actually one of my current partners who worked with Dr. Bourne in Philadelphia, and not surprisingly, they all respect him just as much as I do. I appreciated his dry sense of humor more and more as residency went on. He never got worked up in the OR regardless of the complexity of the case. Dr. Bourne was there when you needed him, but gave us plenty of autonomy in the OR. He always made himself available to trauma fellows on call, including nights and weekends when he wasn't even on call. I can remember calling him on a Sunday afternoon on the day of the Dunkin' Donuts Center mass casualty event when the human chandelier fell. He came right into the hospital to figure out a plan to treat the injured acrobats. Similarly, he came in to help me on a Saturday with a patient with OI who had a femur fracture. He was always a team player. And whenever I was a trauma fellow and there was a long bone fracture and I was on the fence between a nail and a plate, I would always ask Dr. Bourne his opinion, and inevitably he would say, "I'd nail it." Congrats on your well-deserved retirement, Dr. Bourne. Take care.
Hi, Dr. Bourne. Melissa Cristino here. Just wanted to congratulate you on your retirement. I'm so glad I had the honor to train under you. You impacted my life even as a med student, and I learned so much. I'll always appreciate your wisdom that you gave us as trauma fellows, your humility, and also your humor, which is one of my favorite parts about you. So I hope you enjoy everything to come, and I hope to see you again soon. Congratulations.
Dr. Bourne, I wanted to thank you for the incredible experience that I've had learning from you as a resident and being fortunate enough to be your friend since residency. The impact that you've had on my life and career is pretty hard to underestimate. I don't know if you remember, but you're the one responsible for introducing me to one of my best orthopedic friends in Scott Nelson, who I've been to work with in Haiti multiple times. Thanks to you tirelessly working to make a connection so one of your residents and fellows could go have an international experience through the Silver Fellowship. One thing I've never quite understood, although I think I'm starting to get a better sense now, is why you used to really have an interest in Panzer tanks. I remember getting you a shirt that said, "My other car is a Panzer." Interestingly, having dealt with administration increasingly over the last few years, I'm starting to understand it a little better. But I wanted to make sure that I took time to appropriately thank you. I would love to be there with you for your retirement, but it doesn't look like that's going to be possible. But I hope to see you around and get to spend more time with you in person in the future. Thank you for everything you've done for me. I'm a better surgeon, a better husband, a better parent, and because of the time you've spent with me. Thank you.
Dr. Bourne, congratulations on your retirement. Seems like yesterday that you and I met. It was my last interview of interview day, and I was sitting in your office before you got there, and I had time to look around at the different generations of gamma nails and plaques of thank you from the Department of Homeland Security, and another plaque that said Intrepid Hero Professor, and I thought, well, this guy is going to be a super serious G-man. And then just being scared shitless during our interview, but thankfully that worked out, and I had the pleasure of learning later as your resident that yes, you were very serious about surgery and patient care, but also happened to be one of the funniest and kindest people I've ever had the pleasure of working with and knowing. The things that you taught me over those 6 years, I still carry with me, and I use them every day. I use the phrase dropping trodes anytime I find myself doing a surgery I'm pretty sure is going to be consigned to the dustbin of history. I remember going into any bilateral case and you saying, "I got the easy side," something I think of frequently. Words of advice in dealing with snowblowers or life in general, which is never put your hands anywhere you wouldn't put your face, which I think are words to live by. The appropriate level of concern for the polyethylene liner when nailing through a total knee. I remember someone said, "What about the poly?" And I won't use your exact words, but you weren't really concerned about the poly. Coming up to you constantly with ideas for new techniques. I remember Joey and I came up to you saying, "Hey, we got this idea about, reducing a toe dislocation," and you would go straight to write it up. You're tired of people coming up to you with technique ideas. Except one time when Matt Darren and I had an idea for how to reduce ankle fractures in the overweight and obese, and at the time we called it the Walls of Jericho in honor of WWE superstar Chris Jericho. And you said, "No, that name is terrible. You should call it the Providence Pinch." And then you also said, "Well, let's add Dr. Haida to the paper." And at that point, it was me and Matt Darren, and we were talking to you. And then I said, "Oh, good, the Big Four." And you kind of rolled your eyes like that was the stupidest thing you'd ever heard. And in defense, it was pretty stupid. But, here it is. Initial management of ankle fractures in the overweight and obese, the Providence Pinch with the Big Four. Cited by one person. And I also remember you, your humanity. I remember you taking time out of a busy morning at board to kind of stop everything and congratulate Todd on becoming a new father. I remember calling you in the middle of the night countless times as a junior resident, and no matter what was going on, at the end of the call or whatever the time of night, you would say, "Kaveh, thanks for calling," which I thought was nice and touching, given the overall tenor of junior residency. And I remember the proudest moment of my residency personally was, I think we were in the middle of a hip fracture, and things were moving along, and we had some music playing, and you came in and looked at the fluoro and said, "Whose playlist is this?" And I said, "It's my playlist." And you said, nice playlist. And then because things were going so well, you said, I'll dictate. So in any case, you know, Dr. Bourne, you will certainly be remembered by hundreds of orthopedic surgeons. Anytime they're fixing a particularly difficult hip, or whenever the smoke goes up after the election of a new pope. And I consider myself lucky and grateful to be one of them. So Chris, cheers. Happy trails. Thanks for everything. I'll see you around.
Dr. Bourne, it's Amanda Pantry. I just wanted to send my well wishes and well-earned congratulations on your retirement. I am so grateful for all that you taught me during my 6 years at Brown, both in the OR and in clinic and in lectures. I use things that I learned during my training every day, and I am so grateful for you. I am wishing you and your wife all the best with your newly found freedom. All right, take care. Bye.
Warren and Matt Darren, just want to wish you a happy retirement and share one of my stories with you. I remember one of my favorite memories of the trauma year was actually going to clinic and sitting next to you in the office at urgent care. And a lot of times I would leave kind of on purpose, I would leave an x-ray up, either one that I was proud of, so that you could look at it. And I remember pretty early in the year, I had this gamma nail. It was perfectly reduced, and the nail was nice, low center position for the lag screw. And I left it up because I was like, Dr. Bourne will like this one. And I came back and I sat down, and you looked at me and you just said, next time make the lag screw a little bit longer. And that's when I realized that there was a lot to learn. And even when you think you're good, sometimes you need to do it a little bit better. But having you there next to us, even though we didn't operate with you, looking at our x-rays with us and looking at wounds and just talking was actually one of my favorite parts of the fellowship. But I wish you the best in your retirement. Hopefully you get a lot of potting and planting and enjoy all the other parts of life that aren't related to orthopedics. So good luck, Dr. Bourne. I wish you the best.
Dr. Bourne, I wanted to do my video for you at the alma mater where you spent your first 4 years of higher education. As you can see over my right shoulder is the Duke Chapel. I know you miss coming down here and seeing these great basketball games in Cameron Indoor. So I thought this would be fun for you to get my video from here. What's that? He went to UNC. Okay, well I blew that. But anyway, congratulations on your retirement. Can't thank you enough for everything you've done for me. I was trying to go through all my Bourneisms, all the things I learned from you over 6 years at Brown. And I think my favorite as a hand surgeon is don't put your hands where you wouldn't put your face. I think that's a piece of advice that a lot of people could benefit from. Would save me a lot of time at 1 a.m. I'm so happy that you're getting some time to rest and retire, and I look forward to seeing you again soon. Take care.
Hey there, this is Joey Johnson coming from Birmingham, Alabama. Just wanted to take an opportunity to thank Dr. Bourne for everything that he's contributed to mine and everybody else's education. I have a lot of great stories about Dr. Bourne, but given that I don't know who's going to be watching this video, kind of limits what I can tell. But I will give the 2 pieces of advice that he gave me. And I think the first one is that mentorship for young surgeons is absolutely critical, because by convincing other people to do what they want to do best, you can really influence the lives of more patients than you could possibly count. And then the second thing that he said to me that really resonated was that as you move through your career, you have to find out what you're passionate about, identify it, and work towards it. And a lot of times that requires you to kind of change directions, maybe not in your surgical practice, but throughout your life. And I think that keeps this job from being just a job, and it turns it into a career. And I found that to be really critical and important. And then to Dr. Bourne, I just hope you don't think that this means that I'm going to stop calling you for career advice, because even if you change your phone number, I'll still find it. But thank you for everything you've done, and I hope you have a good reception. And I know you're looking forward to what life brings you next, and I think we all are. Have a good one, and thank you.